So the next antibiotic is tetracycline. So tetracycline is the class of antibiotic which inhibit the protein synthesis in the bacteria, right? So tetracycline have the antibiotic which include like demoxycycline, oxytetracycline, tetracycline, doxycycline, and minocycline. So they are the natural and the semi-synthetic tetracyclines have found. In case of natural, it obtained from the culture of streptomyces. So tetracycline is the bacteriostatic antibiotics, right? It inhibits the bacterial growth. So it inhibits the protein synthesis and then it stops the essential function of bacteria, right? So the complication, if I talk about the complication of tetracycline, so tetracycline form the chelate with calcium and magnesium and aluminum ions, so it form the insoluble complex. So therefore the antibiotic tetracycline should not be taken with the milk or dairy product or antacids, right? And iron salt, because it cause from the chelate with the tetracycline antibiotics, right? So these dairy product or antacid reduce the absorption of tetracycline, so which is the where we can say it is the pharmacokinetic interactions like ADME interaction of that drug with the ions. So next is therapeutic use of tetracycline. It is used in the acne, chronic bronchitis, Lyme disease, and Mycoplasma pneumonia infection, rickettsia infection, and some other venereal disease such as chlamydia infections and traveler diarrhea. Right. So next is side effect. Uh, because it has strong affinity with the calcium ions, so it causes the discoloration of permanent teeth, right? So it form the complex, therefore it causes the yellowish color of teeth. It's due to the complex formations, teeth permanently yellowish in colors, right? So and it is the also contraindicated in case of pregnancy and in case of children, so it also contraindicated. So next is alteration in intestinal flora. It increase the chances of super infections. So because it affect alter with the immunity of that body, and then it cause also diarrhea and pseudo membranous colitis. So next antibiotic is aminoglycosides antibiotic. So, friend, the aminoglycoside antibiotic is also natural class of antibiotic which involve gentamicin, kanamycin, neomycin, streptomycin, trobromycin, and amikacin, which is commonly available in the market under the aminoglycoside category. So, used for the various type of infections, right? So, natural and semi-synthetic aminoglycosides available produced from the streptomyces and has poor oral absorptions and no because it's a very potent antibiotic with serious toxicity, and it has bactericidal action. So it kills the gram negative as well as some gram positive bacteria also, right? And next is used to kill the gram negative bacteria, gram negative bacteria like mainly E. coli, Proteus, Proteus cephos, and Klebsiella species, and the Cerita species, and some of these, and used in the combination with other antibiotics for the synergistic effect. Synergistic action mean it increase the action of other antibiotics. But like if it is used with the like other antibiotic like penicillin, So it increase also show the synergistic effect, right? So in other words, three most common the systemic as well as antibiotic available: gentamicin, tobramycin, amikacin, and it causes serious toxicity like nephrotoxicity and renal failure. And the major toxicity is ototoxicity, which means auditory impairment and vestibular and right cranial nerves. So therefore, the must monitor drug level to prevent this toxicity. Right. Next is other side effect of these aminoglycosides. Mainly is ototoxicity and nephrotoxicity, and the most significant. Another one is headache, muscular blocker, paresthesia, dizziness, vertigo, and skin rashes, fever, super infections. Right. So next most used and a new class of antibiotic is quinolones, right? Quinolone. And in quinolone classes, there are the five main antibiotic like ciprofloxacin, enoxins, lomifloxacins, norfloxacins, and ofloxacins. So quinolines are the excellent oral absorptions, right? So therefore, it is beneficially for the in allergy patients because it is self-administered, right? And so good absorption, but the absorption is reduced by the antacids. So why it's like if you I earlier told in tetracycline form the complex with antacid and other ions which reduce the absorption of the tetracycline, but there's some interaction of quinoline also with the, some antacids, so it reduce the absorption of this quinolone also, right? So first oral antibiotic effective against the gram negative bacteria. It is the first oral antibiotic. So next is bactericidal action. It shows bactericidal action and effective against gram-negative bacteria and the some positive bacteria also, right? So if I talk about the mechanism of this antibiotic, it alter the DNA of that bacteria and causing a death. So it do not affect the human DNA. And next is lower respiratory tract infection. It is used in the lower tract infections, bone joint infections. These are the all therapeutic use of this class of antibiotic. In case of UTI, in case of skin infection, sexual transmitted disease like gonorrhea and the syphilis, okay, and it is used for that infections. So another side effect of these antibiotics of quinolone are the if I talk about the side effect related to the CNS, it causes headache, dizziness, fatigue. This is the reported side effect. In GIT, side effect include nausea, vomiting, diarrhea, constipation. And next is macrolide. So it is a similar kind of antibiotic like tetracycline, right? So which include erythromycin, azithromycin, clarithromycin. These mycin word as a used in all antibiotic as a suffix, so it is useful to remember of this class, right? So it is a bactericidal action. It has bactericidal action. And next is use of these antibiotics are mainly in Streptococcus pyogenes, which is a group A beta hemolytic streptococci. And next is and Haemophilus influenza, spirochetal infections, and syphilis and Lyme disease, and gonorrhea and mycoplasma and chlamydia, right? So some and side effect of macrolides are mainly include nausea, vomiting. These are the common side effect. And azithromycin and clarithromycin have fewer side effect are longer duration of action and better efficacy, right? And the better tissue penetrations. So next is precautions of the antibiotics. So before beginning the therapy, assess of drug allergy and hepatic, liver and cardiac functions, so, and other lab studies. So right, so be sure to be the through the patient health history and including the immune status of the patients, right, and assess for the condition that may contraindication to the antibiotic use or that may indicate the suggestion use, right. So assess of potential drug interactions. So another running precaution is patient should be instructed to take antibiotic exactly as prescribed and assess of for sign and symptoms of infections like fever, perennial itching, cough, and lethargy. Next in the precaution is for the safety reason, check the name of that medication and carefully since there are many agents that sound alike or having a similar spelling. So etiquette should be taken, right? Another, each class of antibiotic has specific side effect and drug interaction with must be carefully assessed and monitored. And the most common side effect of antibiotics nausea, vomiting, and diarrhea. Next is sulfonamide should be taken with at least 2400 ml of fluid per day unless contraindicated. So due to the photosensitivity and avoid the sunlight and tanning beds. So these agents, mainly sulfonamides, reduce the effectiveness of that oral contraceptive agents. So the care should be taken so the patient or any person who have taken oral contraceptives and they should not take the sulfonamide, right. Next is some turning point related to the penicillin. So any patients taking a penicillin should be careful monitor for the allergic reactions for at least 30 minutes after its administration. So next is effectiveness of that oral penicillin is also decreased when it taken with caffeine, citrus fruit, cola because it interact with these food and beverages. So it reduce the absorption of antibiotic. So action and because and the antibiotics can't show the action as properly, right? So thank you so much and please like and comment and share this video and subscribe this channel. So and any comment any suggestions please write in the comment box. So thank you so much and watch for watching the video. Thank you guys.